Mike Gibson, Julia Grapsa, coming to you here live with Access Points. Lots today in the heart failure world. Let's start off with the Ironman study. I mean, a lot of folks out there with heart failure have anemia, and they looked at folks who had a hemoglobin level between 9 and 12 and then gave them an iron infusion. What did they find?
That's very interesting because these patients had also an ejection fraction less than 45%. So it shows that these patients with heart failure, they really need the iron infusion. This was a one-shot high dose of iron infusion. And even though it was marginally different, it seems quite promising. It didn't really manage to give significant results, but these are quite important data that maybe they will be proven useful in the future. Also, the authors acknowledged that the difference between AFFIRM AHF trial, which has similar number of patients, around 1,100, but also it showed that these patients that in the AFFIRM AHF trial, they used acute hospitalization, where actually the Ironman used every hospitalization patient. So actually they include patients even from the outpatient clinics. Very important data that a long thought actually about iron levels and how to improvement in our heart failure patients.
Another big one was Transform. A lot of people think torsemide is superior to furosemide. They compared them, no difference.
It was proven actually that these people maybe are wrong. So, like torsemide is a nice medication, but this study was a negative study. The authors emphasize that it's a pragmatic study, like a real-world study, because the physicians actually could choose the dose of the medication. They treated the patient according to the guidelines, of course, but they could change the medication according to their own opinion. So this study has decent limitations. For example, like we don't know the adherence to the medication. We don't know how the dose changed because it's a real-world study, but important results and well done to the authors for this study.
And the other diuretic trial was DCP?
Exactly. So DCP employs chlorthalidone versus hydrochlorothiazide, and it was studied in a veteran hospital, so almost like 13,000 patients randomized. So it's very interesting because it shows, again, it's a negative study, no statistical difference between the two medications, and also chlorthalidone was responsible for a lot of events of hypokalemia.
Yeah. And then I think, for me at least, one of the most exciting studies today was, a lot of people with amyloid cardiomyopathy out there, the wild type, about 200,000, 500,000 of those patients. And, some of the attempts right now are just to turn down the production a bit or mop up the misfolded protein. But these investigators did CRISPR-Cas9 editing of the genes and turned down amyloid production by 90%, all the way through 6 months. We have to look at the clinical outcomes. But seeing that kind of reduction with genetic editing is very exciting.
Very impressive results. I mean, that's one way to clinical progress, one step to treating our patients.
Thanks for joining us today, Julia. Thanks to all of you for joining us here with Access Points.